Mr Speaker, my question is to the Minister for Health and Wellbeing. Can the Minister please update my community at Booleroo Centre regarding the future of the Booleroo Centre GP Registrar? With your leave and that of the House, sir, I'll explain a bit further.
Leave is sought as leave granted.
Thank you very much. Recent events that have occurred at Booleroo Centre will result in the community losing the services of the GP Registrar, resulting in the community members having to travel over an hour for the surrounding locations, which, if they can afford, will take the place of other people in those locations.
The Minister for Health and Wellbeing.
Thank you very much, sir, and I thank the member for Stewart for his question. And certainly, as the members alluded to, there has been an issue where there's currently, as I understand it, 2 doctors providing service in Booleroo Centre. This is primary care services, which of course are under the purview of the federal government, not the state government. One of those doctors was a GP registrar, and due to issues with Medicare eligibility, I understand is likely to be having to withdraw their services in the coming weeks. Of course, that leaves another doctor who is providing services for Booleroo Centre and its community, but we of course want to see those primary care, federal government, GP, Medicare services expanded and strong across regional South Australia, including at Booleroo Centre. And so the state governments, through the York and Northern Local Health Network and our Executive Director of Medical Services, has been working with the practice and trying to do what we can with agencies such as the Rural Doctors Workforce Agency to see if we can increase the staffing when that one doctor leaves. So in terms of the basis of the question that everyone's going to have to travel, I'm advised that won't be the case, given that there will be a doctor there, but obviously we'd like to see that get back up to 2 in the local area. Of course, about half an hour away is Jamestown, where the Goyters line practice is in operation there. And of course, these are issues, of course, that we face across regional South Australia and across regional Australia in terms of GP services. And we are always working with the federal government to try to identify ways in which we can improve the supply of GPs in regional areas. One of those, of course, is the work that we're doing in terms of the single employer model, which is now, having been very successful in the Riverland region of South Australia, is now expanding across the rest of South Australia, where we can have GP registrars working between our public hospital system and primary care system employed by SA Health, with a Medicare exemption to enable that to happen. We're optimistic of the benefit of that. We're also optimistic in terms of the benefit of what's just started in the past year, which is at Flinders University, the new regional medical school, which has now got a whole fleet of medical students who are undertaking their entire practice based in regional areas. So as opposed to a previous scenario where people would do all of their medical school training in the city and then most of their postgraduate training in the city, now people can do the whole lot in regional South Australia, which is a fantastic news, and we're hopeful that that will lead to improvements. In the meantime, of course, we have to continue the work on international recruitment, and of course there's a lot of GPs, particularly from the UK, who have come to Australia and South Australia in the past few years. That has increased, and one of the ways that that has seen increased numbers through the work that we've done to reform through what was called the CRUC review, the process between immigration, the medical board, APRA, the colleges, by which people can jump through all the hoops, particularly from countries like the UK. So for a doctor in the UK now, rather than needing to get separate college accreditation here, they can go through that expedited pathway and have their UK college accreditation recognised here in Australia. And that has helped, not only has helped a number of doctors come through that pathway, but also I think has sharpened the college's pathway and the expedited way that they're doing their applications to get more GPs here into Australia and into South Australia in particular.